Okay, we're good. Good morning, everybody. Happy Wednesday to you. It is a beautiful day, and welcome to our bi-weekly Ask a Doctor series, where we look for questions from you in the audience to ask the doctor. And of course, we're approaching this for the purposes of information and education. This is not meant to replace your relationship with your physician, and we do want you to follow up with any specific questions with your doctor. But hopefully, we can all learn something today. We look forward to interacting with you, and you can do that a couple of ways. Over here in the chat section of YouTube, you can post your questions live, and I'm monitoring those, and I'll ask Dr. Ellithorpe those questions. And you can also email your questions into us, and I have a few that were emailed in this week. The email is office@tlcdoctors.com. Send your questions in there. Put in the subject question for YouTube, question for live Q&A, something along those lines, and those will be forwarded to us, and we'll be sure to get those questions on a following episode. Well, good morning, Dr. Ellithorpe.
Good morning, Talon.
How are you doing today?
I am blessed.
I am as well, too. Should we jump right into some questions? Okay. Lynn posted a question in the chat, and she says, I am taking progesterone 100 milligram capsules as part of my hormone replacement therapy. I understand a cream version is available. Any benefits of one versus the other? Can a patient switch from one to the other?
Yes, you can switch one to the other. Really, it's your absorbability. Some women's skin is just not a good absorption platform, and other women, it's very adequate. I alternate between the two, and I just don't see that there's a preference one for the other unless the patient themselves likes the creams better. But you have to check your blood levels. You have to have a doctor who knows to see what that's doing for you. We like to see the progesterone levels at 4 nanograms per deciliter or higher. You know, it can go up to 20 or so, 30. I've even seen it as high as 40, but you have to have about a 4 to have the impact on the estradiol. So if the estradiol is more than, let's say, 70 or 80, I really want that progesterone at 4 or higher. If the estradiol in a younger woman or a woman on a higher dose of estradiol is like 200, 300, then I certainly want the progesterone in the higher ranges, 8, 10, 12 range.
Okay.
So, Lynn, I would ask her to see her doctor and make sure that blood level is correspondingly serving her for the purpose to bring harmony to the whole hormonal balance between estrogen and progesterone. And I would check that at least annually, if not biannually.
Okay. So other than, you mentioned maybe if there's an issue with skin absorption, but let's assume that the progesterone is showing up and you're happy with the lab levels. Are there any other benefits to taking it topically over orally or orally over topically?
I know of none.
Okay.
You know, I've heard people talk about, oh, you don't want to have it processed through your gut and your liver, your gastrointestinal system. I see no reason to be concerned about that. Your body produces it internally. It goes into your blood and circulates through there. So that over the decades, I've been doing this almost 40 years, is a bogus concern.
Okay. And so it sounds like it's more of just a preference unless you're having some absorption issue either with the skin or orally, which we would check lab levels. Of course, creams, some people don't like creams because they have to put it on topically every day. It can be messy. You have to also be thoughtful, although progesterone is very safe, but getting it on your partner, on your husband or wife, spreading that cream.
Progesterone actually is beneficial for males and females.
Right.
So there is absolutely no, even with children, there's no concern that I've seen over the decades with progesterone. Transference from a topical cream is not to be worried about.
Okay.
The other ones, we do have some concern, the men that apply topical testosterone, that they would do that at a time and in an area that they're unlikely to be touching their loved ones or pets. The same with estradiol. I apply my estradiol to my face, and I'm not never. If a man uses testosterone, he probably wants to apply it on his less hairy area, so it's absorbed in the skin, or in the groin area where you're unlikely to be touching anyone. But
Okay.
again, after you've applied that cream, I would say about 4 minutes later, 5 minutes later, it's done its deed, and you're not going to be transferring anything.
Okay, great. Next question, and I don't know how to pronounce the name, Spissy. Mercola censoring Rand Paul censoring. I would prefer to not use YouTube. Do you broadcast on any other platform?
No, I don't.
We don't currently. No, YouTube is not without its issues, and I know censorship is certainly a concern. However, right now it is what we're using. It's a platform with a lot of users on it, and we're trying to help as many people as possible. But we are looking into other options as well. So stay tuned. If we make any changes, we'll certainly let you know. If you go to our website, you can sign up for our newsletter, and that is where we send out information before we do any of these broadcasts. So if there's any changes, we'll send it out to our newsletter, of course. Okay, I'm not seeing any other questions in the chat at the moment, so I will switch to some that were emailed into us. I have a question that was emailed. Actually, this is from the comments. I believe last week we didn't have time to get to this one. This is from Dina, and Dina said, what can be done if blood work shows low platelets? Could it be something that would show up after having the C19 shot in December?
Yes, that's a possibility because thrombocytopenia, idiopathic thrombocytopenia, or vaccine related, very often when you get ill, the first impact is that your body will get into a readiness phase for fighting it, and you'll be sending your platelets to block bleeding, oozing at some cell damage site. Mm-hmm. And so there'll be platelets used up, depending on when you're getting your blood tested for that. And I just want to let people know, I know you're seeing your labs, and the range for a normal platelet is about 150,000 to 450,000 per deciliter. And we really don't get concerned until the platelet drops below 40,000.
40,000.
Yeah, so that's almost, a threefold drop. And I've actually managed patients quite well on probiotic, helping their gut, who have this undiagnosed. They've seen the hematologist, and of course we use our consultants, and they use probiotic 225, and they eat a very healthy diet, and we find that their platelets improve. Okay. And I've done this for decades with one particular patient. Mm-hmm. Who is in his late 80s now. So you have to let a doctor read your lab and not you get worried over numbers that fall outside of ranges. We have our lab here. I'm trained in chemistry before I became a doctor. And we go over that, and we see all kinds of ranges. You could have the viral illness of any sort alone could drop your platelets. And these are soft signs that something's going on that don't necessarily predict demise. That's very rare. So I would just reassure the patients.
Okay, good answer. Another question just came in through the chat from Doris, who says, I understand that some pharmacies are no longer filling ivermectin prescriptions. Have you heard of this? Any thoughts?
I haven't heard of this because I work with a group of pharmacists. Mostly they are private pharmacy. They own their own pharmacies. They know us doctors over the many decades we've been working here in Southern California. They know that we have a high reputation for doing well. And so when we present our instructions, these pharmacists who own their own private, not the chain pharmacies,
CVS, right.
They have never given any problem for that, or hydroxychloroquine. So I would take your prescription to a privately owned pharmacist who is invested in pleasing his patients. He needs your compliance or
patronage.
Your patronage. Yeah, he needs you because he isn't backed up by some big mega corporation or dollars or insurance. So He's there to serve you and to look at your doctor who's prescribing it and to surveil whether he thinks this is in the correct ranges or reasonable to do.
Mm-hmm. So support your local privately owned pharmacy.
Yes.
And look for one that is privately owned and a smaller non-chain pharmacy.
Yeah.
Yeah, I think of like a Harbor Compounding or Tustin Community Pharmacy here
Right.
locally to us.
Right.
Okay. Alrighty. Let's move on to another question. This was another question from comments that we didn't have time to get to in a previous live YouTube. This one comes from Duncan, and Duncan asks, Doctor, thanks for your videos. What's your opinion about DMSO, applying it topically, ingesting it, and mixing it with other nutrients? Thank you.
DMSO is a solvent. It is a solvent used in medical systems to enhance tissue penetration delivery. And this has been added in IV bags. And you'll get this smell. You can always tell a doctor who has a nutritive IV suite if they're using DMSO because you'll have this kind of like garlic smell because there's so much DMS. S stands for sulfur.
Right.
So this is the sulfur component in DMSO. Very often it's used to be put into topicals to enhance that skin penetration, because the skin, although it is a mechanism to deliver medications, drugs, and other things to the body, it is not necessarily consistent in all people, and you enhance it with DMSO. Taking DMSO orally, I have never prescribed, and I have never been in a group of integrative doctors who have used it orally. I've only seen it intravenously to enhance delivery of nutrients, in particular EDTA chelation therapy, or in topical format to enhance the skin transfer of whatever you are trying to carry into the body. So I'm not opposed to it if you can put up with the odor, and that odor has always been a challenge. And I've not found it necessary to use DMSO in our IVs because we get such great reduction in heavy metal toxicities and then improved microcirculation that I just haven't used it. But no, it's a reasonable thing. I'm just not one who found it necessary to apply in my practice.
Okay. Mm-hmm. Question that was emailed to us earlier this week from Pam, who asks, I was told early on to apply my estradiol cream below the waist. I hear Dr. Althorpe saying she puts it on her face. Now that I am 70, does it matter where it is applied? So we were sort of talking about on the subject earlier.
Yeah, it's kind of funny how things all kind of come in a group. Right. God's in control, ultimately. The estradiol itself has a ability to enhance your collagen and elastin, so it helps with your rebarb, you might say, in the cement of your skin. And so women, men, we tend to get these hard lines and cracks and widow's wrinkles, those kind of things, and in your forehead. Over time, if you're very stressed, a chronic smoker, this tends to be even enhanced. So applying the estradiol to your face indeed is a mechanism for anti-aging, and you know, I think many people have said my complexion and my facial wrinkling for being almost 70 is good. So I'm thankful to God for that. I'm just a busy lady, and so when I wake up in the morning, I go to brush my teeth and I put this cream on, and to my face, it's the quickest thing to my hand, and I just started doing it until I read more about it over the years. And yes, it will help you even if you start now.
Okay. Next question is from RJ that was emailed into us earlier this week as well. I'm in my early 70s. The last 3 to 4 years at my women's yearly health appointment, I have asked my gynecologist if I should have a pap smear test, and she's alluded that I have reached an age that I really don't need one anymore. This doesn't seem right, and I'm no longer given a pap smear to check on my health. I have been very happy with her for the last 20 years, but now I'm wondering if it might be time to find a new gynecologist. Any thoughts concerning this matter will be greatly appreciated. Sincerely, RJ, one of your lucky, grateful patients to have you as their functional doctor.
Oh, Well, thank you, RJ. I appreciate it. We do gynecology here, and the female Pap smears and pelvic exams, and we do certain procedures, endometrial biopsies, colposcopy. We do the Mona Lisa touch for enhancing the vaginal mucosa, even if you can't use estradiol. But in women who are on estradiol and progesterone, we are turning the clock back and asking your body to repair and to function in a more youthful way. When you do that, that means you have estradiol in your body, and we need to take a look, just like we would in a young woman, and look for the impact of estradiol in ways you can't look at yourself. So when you get a pelvic exam, the doctor is looking at the response to the mucous membranes in the vaginal canal and the cervix. If you cycle, some women who are older on natural hormones use the estradiol, and they do have a minor menstrual cycle every month, such as I do. But I use my progesterone cyclically, so at the end of my progesterone phase, I will always have a little cycle. This is normal, but we're traditionally taught that any postmenopausal bleeding is considered cancer until proven otherwise.
Right.
But now, with the decades now of many women who are postmenopausal on and using natural hormones, we're seeing a plethora of women who are having postmenopausal menstrual cycles, such as myself. And I think it's important for you and your doctor to have an understanding about what is to be expected. So if you use your progesterone cyclically, as I do at the first 2 weeks of every month, you would plan to see a menstrual cycle around mid-month, towards the end of your progesterone, when you stop it on the 15th. And measure your levels, because if you have an estradiol that's only 50, but good enough for your purposes of mucosal, when you're having intercourse and you're not raw and thin, then that 50 for that patient is good. But the 50 in another woman may not be good enough. You need to get the estradiol up to maybe 100 or something higher. So I would say when you're getting the estradiol levels up there, the likelihood of having breakthrough bleeding increases. Okay, so your doctor and you need to talk about if you see cycles, and have an annual or at least every 2 years a bimanual pelvic exam with the doctor, a look-see with the pelvic. Do you actually need a scraping to look for cervical cancer and the like? The issue is based on postmenopausal women are usually less sexually active. They have usually not multiple sex partners. And in that framework, the likelihood of them developing a cervical cancer as an older woman is greatly diminished. So that's why her gynecologist is saying that. But if she is on hormones, she should have the pelvic exam, and depending on what that doctor during that exam sees, we'll make a decision after they talk. We'll ask, when we do our pelvics here, are you monogamous? Are you in a stable marriage, and your spouse is not exposed himself to other partners outside of the marriage or relationship? Then when we have that settled, then the individual doctor will decide whether they will do a Pap smear.
Okay. Hope that answers your question, RJ. We do have two OBGYN trained physicians here, Dr. Cindy Mitchell and Janelle Merrick, and both Dr. Kaur as well as P.A. Patel also do gynecological exams as well too. So we're an option for you as well too. I believe you did say that I'm not sure if you said you're a patient here or not, but you could certainly see us as well.
Yeah. I've stopped doing the male genital exam and female genital exam, because my time is best served in working with the complex medical integrative functional approaches.
Right.
Because the pelvic and the urogenital exams for men can be more easily done by them, and I've done enough in my 40 years already, and we have them here, like you said, Talon.
Okay, I'm going to turn back to the chat now. We still have about 10 minutes left, and if you're still watching, thanks. And if you're just joining us, welcome. If you're finding this content valuable and you want to continue seeing this type of format, please do us a favor and give the video a like, the thumbs up button under the screen there. And we want to help as many people as we can. So tell your friends, tell your family about it. And you can actually subscribe to the channel, and that way you will be notified when you log into YouTube when we publish content, because we have a lot more of that coming. We do this every Wednesday morning at 9:45 a.m. Pacific, as well as Dr. Ellithorpe on her own does a longer format Monday evenings at 5:30 p.m. Pacific. Okay, back to the comments. We have one here from Jennifer, who says, I am having chelation IV therapy right now, and it's wonderful. I wanted to encourage Ophelia as she begins chelations. Very safe.
Thank you, Jennifer.
She begins chelations. Very safe.
Thank you, Jennifer. And my patients become often like a family here. And they minister to their fellow patients at various places where they might run into one another for many, many years and decades. And so we, like a family, understand the importance of comfort and reassurance and availability, just that Gibraltar rock, knowing that we're always going to be here for you. The patients are going to befriend you, and this is healthy for your longevity and your immune system. I did have one article last Monday I had brought up in the interim conversation Monday evening. Last weekend, I was listening to a lecture by Dr. Peterson, and he is in, I believe, Texas, and he brought up this paper called Preventing Chronic Disease, Public Health Research, Practice, and Policy. This was their volume 18, E66 for July 21. And the title is Underlying Medical Conditions and Severe Illness Among 540,667 Adults Hospitalized with COVID-19, March of 2020 to March of 2021. So I found the article that I had casually brought up in our conversation last Monday. I read through the article and indeed agreed with what the other physician had reviewed. It was timely. And why I bring it up now is, among all the people that we have hospitalized through the U.S. hospitals and the Premier Healthcare Database system, 4,899,447 were hospitalized from March 20 to March 21 over the year's time. So that's 4,899,000, roughly 5 million COVID. At least of those 540,000, let's just say 541,000, 94.9% had at least one underlying medical condition, essentially, anxiety, and fourthly, the total number of conditions. In other words, they looked up to 10 chronic metabolic conditions, and that would put you in a very high 300. Yes.
It really speaks to, I feel, the mood or just this is taking care of yourself, taking care of your mental health, and then trusting and going to help you weather any kind of storm, not just COVID.
And that is why we're doing these twice a week videos. We're trying to reach out and reduce the fear, reduce the anxiety, create another venue where you don't have to worry about the paying for a visit or this and that. You can ask these general questions. And it's my role to give you the best answers I can give. If I don't have the answer, I will admit it and I will look into it. Like I looked up this article and came the following. Twice a week we're doing this. And in the conclusions, they went and said, hypertension and disorders of lipid metabolism were the most frequent, whereas obesity, diabetes with complications, and anxiety disorders were the strongest risk factors for severe COVID-19 illness. So it is important what grounds you.
Yes.
your parents, your spouse, and very important and socializing the children, because anxiety can depress your immune system.
Chronically, day after day
Yes.
after day.
And this has been going on a year and a half.
Right.
So again, I'll post this at the end here, and population shows the prevalence of each disorder and its impact. So I think it's an excellent article.
Just reminds me that sometimes one of the most important health decisions you can make is just shut off the TV,
Yes.
shut off the news.
Yeah.
And just, I understand that comes through the door, that there's just this sense of lack of control and anxiety about, what can I do about that? And that really speaks to one of the core tenets of what we do here is, no matter what the virus or the bacteria is, or the medical condition, there is so much that we can do
Yes.
preventatively with our diet, with our lifestyle, with proper nutrition, IV nutrition, that can help us withstand.
Yes.
And our bodies are fearfully and wonderfully made to take care of us. So how can you take control when you feel that you don't have control? Well, drink your water, eat well, avoid sugar, avoid processed foods, take supplements that are proven effective, get an occasional IV, do chelation therapy, and just to bring this full circle on chelation and safety. You've been doing chelation and you've been an advocate of it since you were a little girl.
Yes.
You've been around it your whole life. It saved your grandfather. I've done chelation my entire life. And when you're seeing a doctor that understands chelation and its benefits, that has a safe protocol, as we do here, that has decades of experience with it, yes, it is not only a safe treatment, it is almost, I would argue, a necessary treatment.
Yes.
When we're living in such a toxic
In
world.
a toxic world. And I just want to point out, we've had no hospitalizations for COVID or deaths. We've done fabulously over this year and a half. So everything that you're saying, Talon, is so foundational to reassure the patients, the good news, and yes, it's important that we're doing these conversations.
We're just about out of time for today, but I am seeing a couple questions here that allude to, Azar said it looks like he had the vaccination for COVID. He wants to know what to do after the vaccination to improve his health. And then Sean is talking about a friend who tested positive on a PCR test. This person doesn't have immediate access to ivermectin. What supplements and dosages can she take, like high dose vitamin D, C, quercetin, zinc? So a little bit about COVID, the vaccines, and what we can do if either we have it or we've just gotten the vaccine to boost our health.
Well, you can go to the FLCC, and we have these reference sites for you to look at, and we'll post this at the bottom. So I've listed these sites where you can get the protocols. You can try and find a doctor to prescribe ivermectin for those who are diagnosed being positive, but not having serious symptoms. It has been shown to shorten the viral shedding time, decrease hospitalizations, and reduce mortality. So try and find one, and they do have lists there. Of course, you could try and get an appointment here with us. And then the zinc, 25 to 50 milligrams daily. The quercetin, we have DHIST. It's an excellent product. It acts as an antiviral using about 400 to 600 milligrams a day. That's 4 tablets a day. Using the vitamin D, at least 10,000 international units daily. The other thing would be a very low carb diet, a good night's sleep. Systemic enzymes like Vitalzyme, Vascuzyme help prevent the inflammatory component. Those who have had the vaccination and are concerned about the spike protein, I would encourage them to be on Vitalzyme or Vascuzyme on an empty stomach twice a day, 4 to 6, to prevent microcoagulopathies, inflammothrombotic events. Drink plenty of water. Do EDTA chelation. It improves microcirculation from your brain all the way to your toes, and to eat a low carb diet, and to take a walk every day, do some kind of aerobic exercise, get a good night's sleep. We believe in certain foundational nutrients here, such as Juice Plus as an immune enhancer. It has research showing it enhances your immune function. A good multivitamin mineral that has the zinc in it, as well as selenium and other tailored nutraceuticals that are known to stimulate the immune system. That's our TLC core, energy core. Taking the enzymes systemically on an empty stomach morning and evening, taking the vitamin D. I think those items are the core with chelation therapy for circulation. And we've just done a wonderful job here. I have the best patients in the world. They're so good at applying to themselves these self-restrictions to improve their health.
Thank you, doctor.
And I'm proud of my staff, Karen.
I'm too.
Yeah.
All right, well, that is just about all our time today. Doctor, I have to get her ready for her next patient that'll be coming in shortly. But thanks for joining us today, and we will be here again next week. Our next show will be Monday evening, 5:30 p.m. Dr. Ellithorpe will be here on her own. That is a longer format. She usually allows a little bit more time for questions and in-depth answers. And of course, we'll be back here Wednesday together at 9:45 a.m. Pacific time. Thank you, everybody. Don't be anxious for anything, and just take your vitamins, drink your water, get some sunshine, and we look forward to seeing you here on our next episode. Thank you.
God bless.
God bless.